in pursuit of health and wisdom. Sapio with Buck Joffrey.
Welcome back to Sapio with Buck Joffrey. This is Buck Joffrey, and today my guest is Amy Berger. Amy is a U.S. Air Force veteran and certified nutrition specialist who specializes in using low carbohydrate and ketogenic nutrition to help people reclaim their vitality through delicious food, showing them that getting well doesn't require starvation, deprivation, or living at the gym. She's the author of The Alzheimer's Antidote, The Stall Slayer, The 7 Roadblocks to Keto Fat Loss and What to Do About Them, and End Your Carb Confusion, a simple guide to customize your carb intake for optimal health. Amy, welcome to the program.
Thank you. Happy to be here.
Excited to talk to you because, I've spoken at length sort of at what I consider, some of the problems with regard to metabolic syndrome and glucose issues in general and high blood sugar. First of all, why don't we start with this? Why did you get interested in focusing on blood glucose and sugar as a dietitian?
Well, so I'm actually a CNS. I'm a certified nutrition specialist. I don't want the RDs to sue me. I'm not a dietitian.
Oh, okay, got it. Right.
Yeah, it's a master's level, nutrition certification. Sure. And I got into the world of low carb eating because I used to be much heavier than I am now. And I was heavier despite doing what I thought were all the right things, low fat diet, lots of whole grains and margarine on my whole wheat toast and skim milk on my bran cereal. And I could not lose weight no matter what I did. And I actually stumbled upon the Atkins diet. That was my entry into this world. And after seeing how well it worked for me, after having, struggled for years and years with my weight, seeing how well this worked, I had been in and out of a lot of jobs that I was not fulfilled by, did not find rewarding. And it occurred to me, hey, wait a minute, nutritionist is a career. Maybe I could go back to school and get some formal training in this and teach other people about this. So I would say that I got into it personally for weight loss, but over all these years that I've been doing this and now doing it professionally, weight loss is fantastic. Don't get me wrong, but it's such a small piece.
Right.
What this way of eating can do in terms of literally reversing type 2 diabetes, helping people get off their insulin, getting blood pressure normal, restoring fertility in women with PCOS. I mean, the list is endless of things that are either outright caused or made worse by high blood sugar or insulin. And so if you eat in a way that doesn't make your blood sugar and insulin high all the time, these things really get better.
So when you see people who are not familiar with these concepts for the first time, how do you describe sort of the detrimental effect of high blood sugar in that type of eating?
It's actually pretty rare that somebody comes to me who's not already eating this way. Most of the people who contact me for help are already following a low carb or ketogenic type diet, and they just need help getting the results they want. But if somebody is new, the best way to sort of open their eyes is to say, clearly what you're doing now isn't working. So if you're following a low fat diet or, trying to avoid red meat and avoid saturated fat and trying to do, like I did, all the right things, and yet you keep gaining weight or you have diabetes or you've got all these weird unexplained health problems, then you just kind of have to have the courage to do something radically different. Ease the fear is when I say, well, you're already doing this other way and it's not working. Why don't we just do a 30 or 60-day experiment with this other thing and see what happens?
Mm-hmm. How would you say that low-carb diets or ketogenic diets in general allow you to lose weight? From maybe sort of a physiologic standpoint, how would you describe that?
There's a couple of different ways, and to allay the fears of the conventional thinkers, where the conventional thought is that weight loss is simply a matter of calories in and calories out. You have to take in less energy than your body expends. One of the nice benefits of eating this way is that when you eat very little carbohydrate, your blood sugar and your insulin levels tend to stay very steady or stable. And when you're off what I call that blood sugar roller coaster, you tend to not crave the sugar as much, and your appetite and your hunger are much more well controlled. So when that happens, it's so much easier to eat less. And you're eating less not because you're counting calories or points or macros, but because you're simply a lot less hungry.
Mm-hmm.
So this way of eating really helps you work with your biology and physiology instead of working against it. Another beautiful thing, in my opinion, of this way of eating is that you never have to be hungry or starve. If you're hungry, you can eat. You just have to eat things that are very low in carbs.
Right.
So there's more to it than that, but that's probably the quickest and simplest way to explain it.
Yeah. At least from the data, that's probably the simplest and most accepted way to think of at least weight loss, which is you're just not going to be as hungry if you're not focusing on high carb foods, if you're eating more protein, more fats and things like that. But obviously there are, other things that you probably can talk about, but we can move on from there and talk specifically about the additional health effects or benefits of eating in a low carb fashion. How would you describe the benefits of that, sort of, again, starting with it at the sort of basic physiology and then going from there?
People may not appreciate the implications or the effects of chronically high blood sugar. When we hear about blood sugar, we typically think of type 2 diabetes. But type 2 diabetes is the very tiny tip of a much bigger iceberg of health issues that are either caused or made worse by chronically high blood sugar or insulin. And I really can't stress that enough, the insulin part. There are
Right.
millions of people out there who have normal blood sugar and a normal hemoglobin A1C, which is a sort of 3 or 4 month average approximate of your
Mhm.
blood sugar. Those are normal, but these people are swimming in high insulin levels all the time. And that is really the major factor in things like PCOS and non-alcoholic fatty liver and enlarged prostate, erectile dysfunction, and even cardiovascular disease. I mean, it's a huge issue. And so when you eat this way and you maintain much more, quote unquote, normal blood sugar and insulin levels, all of these chronic conditions get much, much better. And
Mm-hmm.
this is well documented in the published, medical and
Sure.
scientific literature. This is not guesswork anymore. This is not false promises. This is all very well documented.
Right. I did an entire show actually on metabolic syndrome. So that's kind of what you're getting at with regards to type 2 diabetes is sort of at the end of the spectrum of diseases that ultimately I think you have, what you're alluding to is that they're all sort of a spectrum of this disease of hyperinsulinemia, right? And at the very far end of that is type 2 diabetes, but you have all this other spectrum of disease processes along the way. And that's what you're potentially, the benefits that you're getting are potentially from that effect. Is that fair?
Yeah, I think that's spot on. And they've even shown that, like you said, type 2 diabetes is sort of the late comer to this game. That is the end stage of this. Your insulin can be elevated for as long as 20 years before
Mm-hmm.
you actually have the high blood sugar, because the insulin is keeping the blood sugar in check all those years. And it's only when the insulin can no longer keep up with how high the blood sugar is going that's when the blood sugar or blood glucose starts to rise and you get diagnosed with prediabetes or type 2, but you've been hyperinsulinemic for years before that.
Yeah. And ultimately you become hyperinsulinemic because of insulin resistance, right? And so maybe you could describe a little bit about high blood sugar. How does that result in insulin resistance?
Well, some people would say that insulin resistance is hyperinsulinemia.
It's a little different, right? Because insulin resistance is ultimately the physiological process that makes it more difficult for the usual function of insulin, of allowing blood sugar into cells. And then, generally the pancreas will overcompensate by making more insulin because of that lack of sensitivity in general. So now you've got this hyperinsulinemia effect from insulin sensitivity, but you're right. They usually absolutely come in tandem because, it's one and the other. It's sort of the same process.
Yeah, I mean, if your cells are not responding to insulin properly, then your pancreas has to pump out that much more to kind of force the cells to listen
Right.
to that signal. And how it connects to glucose is insulin is affected by some other things besides just blood sugar, but your blood sugar level has the strongest impact on your insulin. Insulin rises to help bring it back down. So when this happens over and over and over the course of years and decades, and to be clear, I pride myself on not being some kind of keto zealot, like evangelist. Carbohydrate per se is not poison. Billions of people around the world can eat high carbohydrate foods and they're lean and healthy and don't have any metabolic problems. But millions upon millions of us do not fit that description.
Sure.
And so when we eat certain types of carbohydrates in high amounts, our blood sugar skyrockets, which makes insulin skyrocket. And so we're just swimming in this high glycemic, high insulin state that prevents our bodies from burning fat. You were talking about weight loss before, and one of the biggest things I forgot to say was that everybody thinks of insulin as a blood sugar lowering hormone, and that's true. But that is one small piece of what insulin does. What insulin really is a fat storage hormone.
Mm-hmm.
So when your insulin is high all the time, it's really hard to lose weight,
Right.
which is why it can be difficult to lose weight on a very low fat diet.
Right. Let's jump into sort of the nuances of keto diet, because I, for one, probably am not as familiar as I should be with the sort of strict definition of what a keto diet is, as opposed to, a simple low carb diet. So what's the difference between just being low carb and being truly on a ketogenic diet?
It's really just a spectrum. Keto is one variation of low carb. Keto is just low carb, on crack, if you will. It's a very, very low carbohydrate diet where some people can be perfectly healthy and lose weight and feel great on a low-ish carb diet. Some people really need to take it to the next level and go full ketogenic to get the full benefits, whether that is for mental health or for energy or for, diabetes reversal. But that's really all it is. Keto is just ultra low carbohydrate, where low carb is kind of undefined.
Do you have like a certain threshold that you would define, like in terms of like the amount of carbohydrate intake on a daily basis that would be, traditionally considered more of a true ketogenic diet?
Yeah, it depends on what source you look at. My co-author on the book End Your Carb Confusion, Eric Westman from Duke University, his food list has always been 20 total grams of carbs or fewer for a keto diet, which that's really strict.
Yeah.
Almost everybody will be in ketosis at that point, but some people can have as much as 50 grams of carbs or even like 75 grams of carbs and still actually be ketogenic. It's an individual thing as to how much carbohydrate any one person can have and still be in a ketogenic state. But I would say definitely at 20 grams or fewer, most people will be there.
When you say 20 grams of carbs, is that all comers in terms of carbs, or is it, because obviously you've got lettuce, you've got vegetables that have carbs in them that maybe they're, dietary fiber we can't really digest anyway. Or when you talk about those numbers, are those numbers included?
Good question. In Dr. Westman's list, and this is the same food list that we use, we actually don't subtract fiber just to be on the safe side, because in my opinion, subtracting fiber from things like broccoli or zucchini might be fine. But there's all these newfangled keto products out there, keto ice cream and keto cereal. And if you subtract the fiber, you might end up with a very low carbohydrate product, but it's filled with all kinds of weird, wacky fillers that tend to interfere with people getting the best results from this. So we tend to go by total carbs, and we prefer that people get those carbs from things like non-starchy vegetables. You could have one slice of bread for 20 grams of carbs, or you could have, 2 cups of lettuce or cucumbers and radishes and mushrooms and asparagus and all that stuff. Technically, you could do well eating any carbohydrate as long as the total amount is low enough.
Do you have to do a jump start to actually get into ketosis? I'm curious about this because I actually tried to get into ketosis and I couldn't. And it's just a weird thing. I mean, granted, I was not subtracting out dietary fiber because I was subtracting out dietary fiber, I should say, because I wasn't, I was still eating lettuce. I was still eating vegetables because I didn't really want to give up the dietary fiber for other reasons. But do some people do sort of a jump start on the ketosis and try to burn away all the glycogen storage and all that? Or is there a process usually people go through?
You can do kind of a jump start, but most people don't need to. If most people simply cut the carbs super, super low, within about 48 hours, they will be generating ketones. But I mean, I'm curious, how did you define ketosis? You said you didn't get there. Were you measuring urine ketones?
I was using one of those little urine dips or little sticks, yeah. I mean, and it said maybe I was slightly throwing off some ketones, but it wasn't, there's a range of them and I couldn't get past that first little range. But at any rate, that was more of a person just had a curiosity question. So now we've got sort of, these low carb and ketogenic diet, some working definitions. And what I'm curious about, and I've been thinking about this in general, is that with various diets and various types of styles of diet, in my mind, I think of them in two different ways. And I'll tell you why in a second, but one is a dietary lifestyle, like a long-term lifestyle, and one is an intervention, right? Almost like a drug, right? A guy I follow and who I recently interviewed, Dr. Walter Longo from USC, has the fasting mimetic diet, which really is a diet that ultimately he sees this as an intervention, right? He doesn't see it. I mean, he's literally using it in cancer patients, maybe in people who want to intervene and try to reset various processes, physiological processes. He sees it as a maybe once or maybe 2 or 3 times a year type thing for 5 days. When you think of ketogenic diet, do you personally think of it as an intervention or do you think of it as a lifestyle?
That's a great question, and it really depends on the individual. There are people, the ketogenic diet was originally developed as a dietary treatment for epilepsy. Before anti-epileptic drugs came on the scene, a ketogenic diet was the only way that you could treat seizures. So there are some people, especially if you, and it's not 100% for epilepsy, but it's fairly effective. If you have epilepsy or migraines or some other very, very serious condition, some of those people need to be on a ketogenic diet for life, period. Some people don't. I mean, I definitely don't think everybody needs to be ultra keto all the time. I think you could use it as an intervention or a reset, or like we said earlier, a lot of people can benefit from just cutting carbs to some extent, going on a low or low-ish carb diet. But keto, some people find that keto just makes them feel best, whether they have, that's the only thing that gets rid of the brain fog, or there's actually some really interesting research coming out now on keto for schizophrenia, bipolar, major depression. I don't know if you've had Chris Palmer on, you need to get him on, Harvard psychiatrist. So there are certain issues for which a true strict ketogenic diet is the best, but certainly no, not everybody needs to do this every day for their whole life.
And maybe we can talk a little bit about sort of the keto without crazy, thought process that you have, because I think that, at the end of the day, I'm still a medical doctor, right? And I still have all this training, and it's hard for me to sometimes look at sort of the biohacker perspective on some of these things and sort of throwing the baby out with the bathwater, so to speak, in terms of looking at all these other processes. For example, when people get on ketogenic diets, do you get concerned at all about blood cholesterol levels and things like that?
Well, prefacing my answer by saying, obviously, I'm not a cardiologist.
Right.
I don't get concerned. And there's, again, so much emerging research now that your cholesterol level by itself, including the LDL, tells you nothing about whether or not you actually have atherosclerosis. We've got, so many people now with very, very high LDL who are shown to have a 0 coronary artery calcium score, meaning their cholesterol level is super high, yet they have no plaque buildup in their coronary arteries. So I think that there's a lot of shortcomings with looking at cholesterol as the marker. But again, I'm not a cardiologist.
Yeah. So I am a physician. So let me kind of give you a perspective on that. And I'm not, by any means, I'm just going to tell you my perspective on that, since it is something that people are listening to. I get very concerned about that perspective. And the reason is, while I don't disagree with you that there are people who have high LDL, and specifically we look at ApoB, right? Apolipo-B. What we do know is that high apolipo-B or high LDL cholesterol is necessary, although not sufficient, for atherosclerosis. In other words, if you have a population of people who do not have high LDL cholesterol, they will not have atherosclerosis. It's simple as that. Whereas if you look at a population who has familial hypercholesteremia, they have a much higher frequency of atherosclerosis. So whereas there is this element that you're absolutely right, you do have those outliers. And I think those outliers are in part because this is a multifactorial process, but the process certainly does seem to require this fuel of high cholesterol. But that would be my perspective on that. But what I don't understand in these diets is, like, what's the downside of correcting that cholesterol? If you are on a ketogenic diet, Peter Attia, for example, is I don't know if you know Peter, but he was famously on these diets for years, and is a huge proponent for a lot of people to be on ketogenic diets. But he's also an MD, and he's looked at the same research that I'm referencing with regard to high cholesterol and being necessary but not sufficient for atherosclerosis. What's the downside? Like, why is there so much resistance about treating cholesterol in this population? I'm just curious. I mean, I'm not asking you to, I know it's hard I'm asking you to talk for an entire population of people, but obviously you have that perspective, and I respect that. I'm just trying to understand it.
So it depends on how the cholesterol is addressed. There may not be a downside. My biggest concern is the perhaps overuse or indiscriminate use of statins, because if cholesterol is really the concern, there are if somebody and their physician make a joint shared decision that lowering their cholesterol is the appropriate course of action, I think there are just other ways to do it that have fewer potential, and emphasize potential, adverse side effects compared to statins. There's so many other drugs that I just don't know why statins tend to be the go-to when they have numerous well-documented adverse effects on the US FDA website. So if it is a shared decision between, medical professional and patient that they want to lower their cholesterol, is there a way to do that without triggering some of the adverse side effects?
Right.
Is there a different medication? And again, some people, all they need to do is just increase their carb intake, and that will lower the cholesterol if they want to do that. But if it's somebody who, again, needs a strict ketogenic diet to manage a very severe medical condition, then that has to be weighed against abandoning the diet just for the sake of lowering the cholesterol. But I'm with you. I mean, this is an individual decision that should be made on a case-by-case basis.
Let's talk about, this is, I think, a very interesting space that you're talking about Alzheimer's disease. And I haven't had a chance to read your book, but what I am fascinated about with this is because I actually had a conversation with a neurologist friend about a few weeks ago about this. There's this shift in some level of theory about what causes dementia and what causes Alzheimer's disease. We've always traditionally in medical school learned that it was this deposition of beta amyloid plaques that was causal, that's what caused Alzheimer's disease. But there's a school of thought that's definitely picking up momentum, that is that, in fact, the beta amyloid plaques may be downstream. In other words, they are the effect of what the underlying process is, and that the underlying process may involve two things. One is lower blood flow, and the other is low blood sugar because of insulin resistance at the blood-brain barrier, not allowing for blood sugar to get through the blood-brain barrier and sufficiently allow the brain to, have energy. Now, the good thing about ketone bodies is that the ketone bodies do not require transporters across the blood-brain barrier the way glucose does, so they can freely get in and out. So based on this, just a few weeks ago, I asked my neurologist friend, why isn't every Alzheimer's patient or dementia patient or early cognitive decline patient tried on a ketogenic diet, and is there any long-term studies to that? And he said it was a great question, and that right now there is no long-term data on that, but he thought it was an interesting thing that they should look at. Is that what your book is about?
That is exactly what my book is about.
Okay.
Kudos to this neurologist for recognizing the therapeutic potential of ketones for the brain. I mean, that's my book is absolutely about compromised brain metabolism.
Yeah. So tell me what it is in your words. Now, I've just told you exactly what I thought your book was about. So tell me what your book is about.
So the book, The Alzheimer's Antidote, is mostly about the main problem in the brain of somebody with Alzheimer's and what to do about it. The Alzheimer's brain has lost the capacity to take up and properly metabolize glucose. So it's basically a brain fuel starvation. And we don't know why this happens. We don't know what the cause is, but that is the problem. And like you said, even if glucose is not getting into the brain properly, ketones will still get into the brain. And they've done a ton of studies on this, but like you said, nothing long-term, unfortunately, some relatively short-term stuff. But ketones can and will get into the brain and help close that fuel gap a little bit. And it's, in my opinion, it's the most promising, most encouraging thing on the Alzheimer's frontier, because every single drug developed so far is close to useless. And they don't stop the decline. They don't reverse it. At best, you get worse more slowly.
I think part of the problem with diseases and treating diseases is we have to understand what it is that's causing the disease in the first place, right? And so for so long, we thought it was just a beta amyloid plaque. So we've been targeting beta amyloid deposition and, tau proteins and all that. And so, just looking at this, and just as an additional piece to what you mentioned, I mean, there certainly is data about, as people age, that the blood-brain barrier and the some of the transporters are deficient, become increasingly deficient, and that actually has even been called type 3 diabetes. I don't know. I'm sure you've heard that term. That is effectively what the idea is. I guess, what kind of research is there on this right now? Because I just don't know this literature at all.
It's, like you said, it's to be expected to some extent in a much, much older person that cognitive decline might occur. But we are no longer talking about people in their 80s and 90s. There's people in their 50s and 60s being diagnosed with this. And two of the things that massively increase risk for Alzheimer's are type 2 diabetes or metabolic syndrome and insulin resistance. And, we know that those issues affect just about every tissue system in the body, right? Your liver, your kidneys, the prostate, the ovaries, the skin, And why would we think that the brain is immune? Why would we think that the brain and central nervous system are immune to the ravages of chronically high blood sugar and insulin? There's a lot of overlap even between everything we've been talking about, not just Alzheimer's, but Parkinson's and multiple sclerosis.
Sure.
So it's, again, the research is happening, and it's promising, and it's going to take a sea change, I think, to get more money this way. But I do know the Alzheimer's Association is actually funding some of this research. There's a researcher up in Canada who gets some grants from the Alzheimer's Association to do exactly this kind of research on ketones for memory.
before we cut out, I just want to make sure that when you talk about some of the keto crazy stuff, can you just talk a little bit about that? Because I think, and I think this is an important point, because even with longevity stuff that I talk about, I always try to be mindful of the fact that if I want this message to be broader, it has to be, doesn't have to sound crazy, right? Like, I mean, if you tell people to exercise, like, tell them how much, what the minimal dose, effective dose might be, and try to get people to exercise and tell them why. But, a lot of times people look at the crazy that goes on, especially social media, when you link it to various types of diets or various types of lifestyles, and it just completely turns them off. So what is keto without crazy?
Thank you for asking, because this is probably my biggest passion right now. When I was new to this, 15, 20 years ago, actually, even long before that, Facebook, YouTube, Instagram, Reddit did not exist. You read the Atkins book, or you read another famous book called Protein Power, and you just followed the plan and life was grand. And now there's so many, and I hate this word, but influencers.
I know.
People out there, there's so many mixed messages, and it's so overcomplicated that I have so many clients who are paralyzed with terror and with confusion. Don't eat this type of vegetable is poison. This has this compound that's killing you, and you can't eat this from the supermarket. And this is such a huge roadblock to people doing something that could literally change their life, which is just cut back on the carbohydrate you eat. And there is a time and place to micromanage the details, but don't start there. If anyone listening to this feels that way, feels confused and totally paralyzed and terrorized by the avalanche of conflicting information, just stick to the basic principles, the fundamental thing of just start substantially cutting back on your carb intake. That alone is going to get most people pretty far. And it's very disheartening to see how sensationalist and how clickbaity this has all become.
Yeah.
Compared to when I started, and it was so simple to just get into it.
And the other thing that I would just say is that I think it's it's hard to have a real conversation now. Even we just had this conversation about dietary, not dietary, but cholesterol levels, blood cholesterol. Dietary is a completely different issue altogether. But blood cholesterol levels, people are very reluctant to be open to different opinions on this kind of stuff. It's just really challenging, because this shouldn't be religion, right? This is science. And so people need to be listening to try to get real information. I think that's a real challenge in this space for me, certainly. So anyway, I want to thank you for being on the show again. The latest book is The Alzheimer's Antidote. And again, I think it's an absolutely fascinating place. And I'm really eager to see what happens with Alzheimer's treatment based on ketogenic interventions. And where else can we learn about you?
My main website is in desperate need of overhaul, so I would send people to stallslayer.com, like as in breaking fat loss stalls, stallslayer.com. And I'm also the lead nutritionist at Adapt Your Life Academy, and that's where we do online courses about all this. So adaptyourlifeacademy.com has a whole bunch of courses about keto, and we have one on cholesterol, we have one on sugar and food addiction. So lots of good stuff there.
Yeah. Thanks so much for being on the show.
Yeah, thank you. Thanks for having me.
Thanks for listening to Sapio with Buck Joffrey. A quick reminder that while I am, in fact, a surgeon, nothing I say should be construed as medical advice. Now, make sure to include your physician in any medical decisions you make. And also, if you're enjoying the show, please make sure to show your support with a like, share, or subscribe. Until next time, this is Buck Joffrey for Sapio with Buck Joffrey.